Hillary and Karen, it's great to be with you both today and talking about some really important work that you've both been a key part of. So, Hillary, I want to start with you. Can you talk a little bit about what inspired the development of the framework for aligning sectors?
I love being asked that because I feel like I've sort of lived in it, in this information and the things went into it for a long time. And I'm going to start with a personal note. As you both know, but people who like listen to this would know, I grew up in a little town in West Virginia, and in my childhood, I watched all different kinds of people and organizations get together in the months, and I would even say in the years after we had a pretty big flood. And that, I think it really instilled in me a belief that that people, that communities, that regions can do big hard things, and that people can make complex systems better, and that a community can really do things that help people thrive together in ways that don't leave so many people behind. And when they come together and when they work outside of their sort of their natural day-to-day spaces and boundaries. And so that it's sort of been with me always, since I was a kid. So I came into this sort of primed, into my professional career, sort of primed to look for that sort of thing. So that was my background. My inclination brought me here, and um, what I would say is that the framework for aligning sectors was born out of years of watching and learning from others, not just me, my colleagues, certainly with lots of colleagues at Robert Wood Johnson Foundation, with Karen and folks at Georgia Health Policy Center, and lots of different organizations. I've been drawn to work with and watch and learn from the health systems and the public health agencies, not really those that had like the newest or flashiest technology, but really those with the strongest and most sustainable relationships with each other and with the community that they serve. So, I'm going to go a little further with this and get in more of the story and like what helped us build, a lot of us together, build what became this framework that underlies this. Um, my my colleagues and I at RWJF have over years, we've funded and worked with a wide array of local collaboratives, different kinds of healthcare organizations, community-based organizations, human service organizations, public health, and so on, and to fund them and support them to work together to improve health and prevention, and like upstream factors like social determinants of health, and increasingly in the last 5 or 6 years, I would say, really to do more to work on fixing things about healthcare and public health that really treat and serve some people differently than others, that these like structural inequities. And we saw, a lot of us really started seeing common patterns in different places where they seemed to be working together better, and that built more connections and more connective tissue amongst healthcare and with community members, with community organizations. And some of the things we learned from, I think I'd like to name a few examples of them. In it, maybe you all remember with me, right? In 2011, we were all learning about Summit County, Ohio's variation on an accountable community organization, an ACO. What they called theirs an accountable care community. And there, the health system had a greater breadth of community relationships with some really important structures than I think than I'd really seen before. Maybe you all had been seeing it already, but 2011, that really caught my attention. And then with the CMMI, the Center for Medicaid Medicare Innovations state innovation models, that kicked off in 2013 and produced, for example, Washington and Rhode Island models that had really great, strong connections between public health and healthcare and community organizations, with with real involvement from community members over time. And we learned more from Vermont's Accountable Communities for Health. Uh, Really, in 2015, we saw a bunch about the sort of the patterns that support these connections with this great paper that Prevention Institute wrote called Accountable Communities for Health. I wrote this down to make sure I get it right. Accountable Communities for Health, Opportunities and Recommendations. And that came out in 2015. And Vermont's model sort of emerged out of that period of time. We all remember watching the Build Health Challenge when it kicked off in 2015 and showed a wide array of community examples of connections between healthcare and community, different organizations. And the California model for accountable communities, CACHI, CACHI, that kicked off in 2016. So, and there's others that I haven't mentioned. But all of these efforts, they helped us, helped us in RWJF and our collaborators at Georgia Health Policy Center and then other places, helped us see commonalities amongst partnerships between health systems that have community, partnerships with community-based organizations and public health and others. And the commonalities in those relationships that seem to make them more sturdy and lasting, more be resilient and I would say adaptable to different challenges and able to adapt to different opportunities, challenges like COVID, and also able to actually help everyone in their community, no matter the color of their skin, no matter their ability, no matter their life circumstances, to be able to better help them thrive, to help to be more equitable, connected systems. So, so my colleagues and I at RWJF, sort of how that framework actually came out of all that, my colleagues and I at RWJF were tracking what we were learning and the patterns we were seeing from all of these different things. Some things we funded, others that we got to learn from, and so were others. Karen and Glenn Landers and the folks at Georgia Health Policy Center certainly were also. And we had a conversation one day, Karen and I, where I showed her my list of factors that seem to really support these connections. And the things that we saw again and again in these examples and models that seem to support lasting, equitable connections. And we sort of verbally sketched it out together because she'd been seeing these things and learning from them as well. And we did so with Glenn Landers as well. And that became a precursor sort of sketch, which then the Georgia Health Policy Center team took and turned into the first real draft of this framework. They really ran with it, talking to others to pressure test it, and built a research plan around it, essentially to really test it and turn it into a useful framework.
That's an incredible foundation that this framework has been built off of. So, Karen, would love to turn to you at Georgia Health Policy Center. Not only have you and your team helped to develop what the framework is, but you've been helping organizations on the ground take a look at their own work in community and use the framework to drive improvements. So, can you talk a few minutes about what are the key aspects of the framework itself? What are the elements of it that you have focused on in communities?
Well, thank you for having me. And it is really an honor to be here with both of you in doing this work. Hillary, I think you're kind of humble and giving me credit because you had it kind of sketched out already. I was just adding a few ideas, but we did over several years develop and put more texture and bring more people in the field and in the communities into the design of the framework. And these basic core elements of shared purpose, data, governance, and financing we knew were important. And we wondered how they fit together. And as we began to work with people and work with the research and people being involved with community partners in their research, we learned more about the importance of community voice, equity, the power dynamics, and trust. And we realized, in fact, that these issues around community voice and community power were probably more important than some of the other things. And there was a drumbeat of listen to the community, include the community. And we were so excited when the American Hospital Association agreed for us to sponsor the issue of the journal that brought these researchers together to share their experience in doing research that involved in community engaged scholarship.
Yeah, that's such a critical part, that in addition to doing the work of making change on the ground, understanding how do we document that How do we provide evidence that others can use to replicate or to do something similar in their own communities to build that science around community engagement and community health in ways that we just have not yet done, to this point. And so we were very happy to have a special issue of Health Services Research. And I'll give more information to folks at the end about how you can find those articles, but want to focus in on a few of those. This podcast series will focus in on some of the key on the ground learnings that came out of those articles. One of which, so Karen, I'd like to kind of stay with you and drill down on some of those key learnings and what you saw as you were working with different organizations. One of the key things was the importance of collaboration between the hospital or health system and the community, particularly in rural settings. What did you see in collaborations that made them most successful?
Well, I think that we learned that there is a spectrum of community engagement, and sometimes people think about community engagement as interviewing someone or having them fill out a survey or maybe a focus group. But the deeper kinds of community engagement that allow people to be involved and maybe create the environment that they can be involved, that their time is covered, that their needs are met, and that they get a say actually in the outcomes, in the way that things are done, in how the money is spent. And so we began to see this spectrum. And in the case that people are going to be able to hear about, the person who was the community engaged participant actually became an employee and a leader in the organization. And that's kind of what we would like to see as it relates to the partnership between the health system and the community.
And another key piece I think that folks will hear about as the podcast series rolls out is around data and information sharing and what that can look like and perhaps what it should look like. So what did you find overall in working with organizations about factors that really helped to ensure the success of data sharing between organizations?
I think this is one of the more difficult areas. And some of it has to do with how mature the community information systems are and how they aren't quite ready to, in every case, be connected with the other parts of the system. So some of the stories related to data are that data is important. It's important for people to know and understand data about them and about their work, and that the systems that we have are not quite ready to give us everything that we need. And we loved the story you're going to hear where a research organization worked with a community organization and they really tried to study how the people in the community could use a particular data system. And one of the things that they learned was that you're not making it easy enough for us. It's not worth it. So I think we have a lot to learn in this area of making the data available in ways that um, that people can use it.
Yeah, that's not dissimilar to what we see within health systems, where we have a lot of data, but that doesn't necessarily mean we have good actionable information. And so how do you make that? How do you transform data for the user, whether it be a clinician user or a community user, and transform it into information that will help them understand what to do differently or what to drill down on. That's just such a common issue that we have across systems.
But we did see a case where the health system freely shared the hospital inpatient data in an appropriate way with the community to help them figure out what to do in their work. It's a little bit hard when you're in an academic setting and you're doing a journal issue And generally, you want to have in a journal very positive. You want to have a real strong results and powerful results. And when you have to say, well, we got a ways to go in this area, it's hard. But I have to commend the journal for being willing to publish the story of how things need to be and not always the the very best possible outcome.
The last key area that comes out in one of the podcasts is around funding and what funding models or strategies have been most effective in supporting that sustainable community alignment and system alignment within communities. What did you find there?
Well, this is an area that is really interesting and important, and one that we're learning a lot more about now. And it's a part of our ongoing work that has to do with some work that's being done at the New York Federal Reserve as it relates to social investment. And so we began to learn a lot through these research projects, and there is more and more that is emerging almost on a daily basis with regard to this work. And the story that you're going to hear in the podcast, the one that is done by the University of Washington with one of their tribal partners, is an incredible story, not only related to the money and how the financing works and the complexity of the tribal environment, but also the kinds of relationships that need to occur over time in order to even begin to do this type of research.
Mhm. Yeah. Hillary, you've been listening in, and I love how you talked in your introductory comments about the framework that you and your colleagues at RWJF, along with others, really have seen a lot of common elements or common patterns that underlie success in terms of partnership. I'm wondering, listening to Karen, thinking about your own work and the work of this project and this framework, are there other things that you'd like to call to our attention in terms of what elements have been most successful at that community level?
There are, and I think I'm going to answer it just maybe slightly different than you asked it, because you know, listening to Karen and thinking about this, and also thinking about where this framework came from, got me thinking about what headspace I and many of us were in about this, some years ago, before all of this great research that's in the issue. And I think when I must have really thought, some years back when we first came out with this framework, I must have really thought that the sort of the adaptive relational facets of the framework, things like earning and then really maintaining trust between the different partners and between for example, the health system and the trusted the CBOs and organizations trusted by the community and the public health and so forth. So earning and maintaining trust, and then attending to power dynamics amongst the relationships, and having real roles and leadership for community members and the CBOs they trust in these partnerships. That these factors, these considerations, these parts of the connective tissue were similarly important to getting the data connected between the organizations and getting the financial reimbursements and incentives just right, and the distribution and flow of funds just right. But they're not equally important. They're more important. And now I'm so used to that lesson, that insight, and I feel like I've seen it play out again and again so many times that I feel like I've already always known it. But I realize, I think some years back, I must have thought all of these are similarly important, and they're just sort of like puzzle pieces that we just have to click into place. And when they're all in place, then, or gears that we click into place, and when they're all in place, then it will work. And these adaptive relational factors are really seem to be more important. And having the trust and the collaborative approaches to leadership in place, they support more successful data sharing. and implementing changes to sort of financial flows and incentives. And they help people in a place who are working together adapt and work through tough technical challenges. We see that through play out in the evidence in some of these articles as well. And then, so, I'll just add a piece that having a strong collaborative governance structure really seems to be a necessary bridge between the adaptive, like, relational factors like trust and power dynamics, and being able to then build in the sort of the data systems and the financial flows, so that you can sort of maintain the relationships, maintain the trust over time in a more sustainable way, and do so in a way that the power dynamics, a lot of that, addressing that, is about being able to do this work in a way that is more equitable, that helps the partnership be able to work on some of the things um, in their structures, in their community, that make it hardest for some parts of their community to be healthy. So anyway, there's been so many lessons about this sort of pattern of things, about that. So many of them boil back down to working on the trust and the relationships and the power dynamics.
Yeah, it really struck me as you were talking. That seems like so basic and yet is kind of a concept that eludes many of us. But it's the same no matter what relationship we're talking about. In our personal relationships,
Right.
the reason why we're able to figure things out and try new things or have failures and just be able to move past them and try again is because of that underlying bond of trust. If you think about the physician patient relationship,
Right.
the most
Right.
important thing is that there is that bond of trust, because that allows for changes along the way in the care delivery for that person. So it's kind of the same thing in community, that trust allows mistakes to happen because they're going to,
Right.
allows
Right.
changes in direction when you see that something's not going as intended and you want to course correct. So yeah,
Right.
go ahead.
And also when like, for when people get an idea about a new data system, a new information infrastructure they want to build and put in place in their community, they often want to jump to building it. Once they have the money for it figured out, they want to jump to building it. And so often the kinds of things that make it not go the way you want it to go boil down to not having a lot of the relational trust pieces and structures to support trust and working through hard processes, and not having the right kinds of inputs and points of view considered equally when things are being decided and designed. So some of the problems you run into in implementation of those data systems some of the problems can be prevented by really putting time into building the trust, attending to power dynamics, and building a collaborative sort of infrastructure with community members, with organizations that are most trusted by community members. As you're getting into it, it feels like you're delaying everything, but really what you're doing is making it so that it can ultimately be more successful.
Yeah. So much good content has been part of this project, has been part of the evidence that's been published in the journal, and that folks are going to hear about in the upcoming podcasts in this series. So I want to close with a question to each of you. What advice? What's your Monday morning quarterback advice about that you would give to organizations or leaders who are just beginning to focus differently or fostering differently a stronger connection with their community partner? Where should they start, or maybe what should they avoid? What's just one or two things? Karen, I'll start with you.
Well, I would say first something similar to what I said earlier, and that is listen to the people. Uh, think about the power and the importance of community voice in the development of the work from the beginning, throughout, and in all aspects. The other thing that we saw in this work was that while people were committed to equity, there was not a strong understanding of exactly how to pursue it. And so I guess my advice in that area is don't give up. Even though it might not seem clear or it seems hard, keep on trying and keep on pushing as it relates to issues of equity. And my third thing is I think that money is very important in driving the energy and the opportunities in communities. And so, thinking about the resources, how to get social investment in communities, how to build on what's in the community with external support that's not a grant to grant mentality, but a more of an investment mentality.
Thanks. Hillary, what would you add?
I love what Karen just said, first of all. So thanks for that, Karen. Let's see, some different things. Um, so we have, because of this work that's published in the journal, and also from this sort of wider body of work, and other evaluations that have been coming out in the last few years, we have a lot of evidence to learn from and a lot of models to learn from. But one size is not going to fit all settings. So that's one. So while it's important to actually check out the evidence, we have evidence about a lot of what has worked and what hasn't worked, but we're pretty sure that one size is one particular model, one particular approach to these relationships in communities is not going to work equally well in all places. So that's one reflection. Another is, we've already been talking in this podcast, in this exchange, about how much trust matters. So I won't keep banging on that drum. But what I will say is that I know that to say that isn't so easy, and that sometimes, in order to build the trust you need, in as Karen is saying, let's following the lead of community members and building the trust you need, sometimes you have to take a step back and look at the past history of your health system's relationship with the community and with community members, community groups. And because there might be some things that happen in the past that you want to revisit, and there might be some sort of repair and reconciliation work that would really help to build the trust you need to be able to have that more sort of collaborative design, collaborative approach, collaborative leadership that is going to undergird your success. And then I'll sort of finish with essentially saying what I said before is, really, as tempting as it is, don't skip ahead to the technical supports and solutions. As Karen already said in her reflections, you really do have to start with the relationships, the relational pieces first, to make sure that the thing you're building is being done in a way that that serves what's actually needed and that organizations can actually use. So all of those are going to be super important in both what Karen offered and these things. And there's probably many more lessons that are really valuable considerations in building these relationships, building these partnerships, with community members, with community organizations, as a health system.
I was going to add something to what you're saying, Hillary, and that is one of the things that I think we're learning more about as we think to the future, and the next phase of research is about the vital conditions, thinking about housing, work and wealth, health and safety, lifelong learning, transportation, and the natural world. But one of the vital conditions is around belonging and civic muscle. And early research is showing that when you increase the vital condition of belonging and civic muscle, the whole pie gets bigger, and you're able to address all of these other things more. So I think we have some interesting learning to come that's going to affirm what you just said, Hillary, about the importance of collaboration.
Well, I want to thank you both for that, and look forward to continuing to learn together with both of you, and thank you for the service that you've both provided at the national level to help foster better relationships and improved health in communities. To our audience, I also want to say thank you for the work that each one of you do every day to improve health in your organizations, in your communities. Make sure to check out the rest of the podcasts in this series, as well as link to the journal that contains the evidence that came forth as part of this project. And we'll have links to some of the tactical resources as well for you to check out. Be well and have a good day.